Today we learn something about common cold. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Introduction. It is a very common illness and accounts for a lot of working days lost at various throughout the world. It is caused by a variety of viruses. Basically, it is harmless and symptoms usually resolve in 7 to 10 days. Commonly seen in the winter months. So, this is about the common cold. It's caused by a variety of viruses and its symptoms usually resolve in 7 to 10 days. Features. It spreads easily from person to person. It is usually self-treatable and diagnosed. Lab test and X-ray is not required. And usually resolves within days to week, perhaps 10 days spread. So it spreads from person to person via the airborne respiratory droplets or touching a contaminated surface such as doorknob, again saliva such as during kissing, skin to skin contact, and it can spread to others 1 to 2 days prior to onset of symptoms till the symptoms resolve. So if you get symptoms say 3rd day from today, for the next 2 days you can spread the infection to others. There are various risk factors associated with the common cold. Age, infants and children, especially if they are going in a crash. Compromised immune system, patient is having on some immunosuppressant drugs. Time of the year, that is the winter months, more common. Smoking, it causes increased susceptibility to cold. And moving at crowded places makes people have more chance of infection, going in the crowded markets, buses or trains. So if somebody has infection, it can more likely to spread to you. Whereas if you stay in the open spaces, chances of getting infection are less. Having a runny nose or sneezing, nasal congestion. If you have high fever, visit a doctor. So runny nose and sneezing and nasal congestion are mild symptoms, but if you have high fever, please visit a doctor. There are also other symptoms that may be associated, such as myalgia, which is pain in muscles, cough with or without expectoration, eyes, there may be watery or itchiness or redness of the eyes. There can be loss of smell. There can be chills, fatigue and body ache and headache. So these are the other common symptoms. Besides this, there may be some other symptoms which I have not described over here. Now, when you visit, what is required when you visit the doctor? Symptoms that worsen or fail to improve. Then you need to visit the doctor. Again, if you get fever more than 101.3 degrees Fahrenheit, you're supposed to visit a doctor. So in between the fever, if you get a relapse of fever after a fever-free period, then again you're supposed to visit the doctor. If you have shortness of breath, wheezing, severe sore throat, headache or pain, then again you have to visit a doctor. There are various complications that can be associated with a cold, that is ear infection. You may get a precipitated asthma, acute sinusitis, and other infections can also be caused by common cold. Susceptibility to other infections increases. There are various home remedies you can try before visit to the doctor. So you can try drink plenty of fluids, sip warm liquids, take some rest, adjust the room temperature to a bit on the warmer side, humidify the air so that the secretions from the lungs can come out, and warm saline gargle or steam inhalation. So you should gargle for at least 3 to 4 minutes either with warm saline gargle or steam inhalation. I personally prefer steam inhalation because it enters into the lower respiratory tract and can prevent infection spreading to the lower respiratory tract, and also it penetrates better into the ear part. And if you want, you can try saline nasal drops. Of course, there is no obvious treatment for common cold. Drink plenty of liquids, keep the air humidified, take steam inhalation, and adequate rest. The treatment makes the symptoms come down and makes you feel better. But of course, this is not the curative part. You can use nasal decongestants. You can try some anti-allergics, pain relievers, painkillers, and cough syrups. These all reduce the symptoms and makes you feel better, but this is not the exact treatment. Prevention. Remember that for common cold, no vaccine is available, so we have to take care of ourselves. So wash your hands properly to prevent surface to surface contact. You can either wash your hands with soap and water for at least 20 seconds or an alcohol based sanitizer. Disinfect your items. So if you're using a pen, pencil, mobile, well then disinfect them. Cover your cough. Just suppose you're in a public place or in your home and you have a cough, then you cover your cough with a mouth, and if you want to sneeze, sneeze in a handkerchief so that the respiratory droplets do not spread and others get infection from you. And don't share glasses, eating utensils and towels, etc. Now anybody in the house is affected, then maintain a distance from that person, and obviously take care of yourself. Do some bit of exercise, eat nutritious food. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share link with your friends. Thank you once again.